Thank you for kind words. Topic is legal issues in clinical practice and how to manage medico-legal problems. Warm welcome all the delegates and wishing you a litigation-free practice. At the outset, I would like to thank organizers of Medicon 2015 and Dr. Usarani in particular for inviting me to share my views about the subject. Story of a young delegate from Ahmedabad, I belong to Ahmedabad, met today morning when I started for Solapur. He told, both of us were in standard 12th classroom together. I went for MBBS, she went for BSc. I was an intern, she got a job in software. I was giving PG entrance, she got married. I took up gynecology, she became a mother of two. My yearly income was 2.5 lakhs, her monthly family income was that much. I started my nursing home, her children went to school. Most depressing fact is, today she is getting her tuberculosis done and I am not even engaged in attending this type of lectures in medico-legal aspect. So spread this story and discourage our children from taking up medicine. It was in a lighter way. If they are not smart enough to learn from this story, while they are preparing for their CET, what is the pathophysiology of sudden death on table? How will I manage and prevent it? And how will I defend myself? Because they will have to work in this generation. Operation सफल रहा, अब डॉक्टर को कोई खतरा नहीं. So is it worth discussing? Yes. Then why? Because medical litigations are increasing in number constantly and steadily. And this is statistic from PPS scheme, that is Professional Protection Scheme run by IMA Gujarat State. Very unique scheme, and on 31st of March 2014, total membership is 12,396. In this scheme, if at all any member gets any notice or summon, then scheme takes all the interest. We have panel of advocates even in smaller town. So we give list of advocate to the member. He selects advocate and then advocate will assist him in all his legal consequences. If at all he loses the case, then scheme will pay the compensation. Member has not to pay anything. So this is unique scheme run by IMA GSB, that is Gujarat State Branch. So on 31st of March 2014, these were the membership, and out of those, 1,920 members were facing litigation in one way or other. So almost 15%, 15% members are facing litigations. And in our clinical practice, we have to save patient, we have to satisfy relative, and at the same time we have to save our own cap. So this is clinical practice. And our situation is like this. We doctors are just like persons in the cage, always at danger from so many factors. An expectation of the society from doctor is very much. Doctors should act or react in any given situation with best the result. And what is the mindset on part of patient? Get more and pay less. And ignorance of law is no excuse. Because as soon as any act, any law, any ordinance passes in government gazette, it is presumed by law, each and every citizen of India knows that law. So ignorance of law can never be an excuse. And many times it happens when we are happily enjoying train journey, from our own window we see our own train going into hell. This is real picture taken during Navy exercise of British Army near sea coast of South Africa, and this accident was happened. And we doctors are just like this innocent bird, always at danger of cobra of law. An accident may happen in clinical practice at any time like this. Like this. So this is clinical practice. It may happen like this also. So emergencies are like 9/11. It is very late sometimes when we diagnose the thing, and one cannot be smarter like this in every given situation. And many times we say, where was King Kong when we needed him best? And etiology is very hard to find out and difficult to diagnose in some of the cases. And after the ship is sunk, everybody knows how it could have been saved. And patient or relative of patient may go hostile, like my son in his younger age. And many a times, so many of friends in their mind is like this. This will never happen to my patient. I am always there to help him. But before December 2004, we were not aware of tsunami. But when the death toll stood at 1,69,752, with 1,27,294 people listed missing, and then only we came out seriousness of the condition of tsunami. So many a times, our friends enjoying their practice just like this tiger in the forest, they never worry or bother about minor complication, but complication may occur at any time and may disturb at any time. This is complication. So as far as medico-legal practice are concerned, there are so many laws we have to observe. Labor laws, PCP&DT Act, criminal cases, CPA, Ntp Act, Professional Tax Act, Atrocity Act, Income Tax Act, Biomedical Waste Disposal Act, Birth and Death Registration Act, Hospital Establishment Act, and of course, Medical Council. So we have to observe this much acts when we practice medicine. So our situation is like this. We are studied with so many laws and still we have to work in smooth and efficient manner. Every challenging case is a potential threat as far as medico-legal consequences are concerned. And treating a serious patient could be suicide as far as medico-legal consequences are concerned. And scenario may change in clinical practice at any time like this, like this. And we are bombarded with so many questions when something goes wrong. Why this happened? Where were you? How you couldn't prevent it? Who is responsible for that? So there are so many questions we have to face when something goes wrong. Let us see some cases. It was unbooked patient, investigated and treated by another gynecologist, came at 7 a.m. with labor pain. She had breach at perineum. She was delivered by assisted breech delivery, but after normal delivery of placenta and membrane, she developed convulsions and sudden cardiac arrest. She was resuscitated well. Opinion and help from physician and anesthesiologist were taken, and ultimately they decided to shift patient to tertiary care center for further intensive care. During the course of treatment, patient expired on the 4th day of the treatment. So case was filed. An allegation on part of relative of patient was, we had been to that gynecologist for normal consultation only, but he gave heavy injection in glucose bottle, so she delivered and developed convulsions and cardiac arrest. Doctor gave all his documents and papers of treatment given to his advocate, but he didn't bother to remain present in the court even once. Anyhow, that advocate didn't produce those paper of treatment given to the court. So another inference held in the court was doctor has not produced any document about treatment given, and doctor has not bothered to remain present in the court even once. So compensation of rupees 3 lakhs with cost, with interest was awarded in favor of relative of patient. So carry home message with this case is never rely upon advocate totally. Be in constant touch of your advocate and give him inputs about medical grounds and literature, both in favor and against. Let us see one more case. It is a case, hospital gave information of HIV positive patient to his fiancé. So there was case, it is breach of confidentiality. And inference held in court was, it was in public interest, so doctor was not held liable in this particular case. So in this particular case, it was discussed and decided that consent at the time of advising for HIV testing. What should be the consent and counseling during advising the test for HIV? Informed and voluntary consent of person being tested, because HIV is not curable, its implications are life-threatening, stigma attached to HIV is unprecedented, and knowledge of HIV positive status itself may lead a person to unfold trauma, including suicide. So, counseling is needed, which is a confidential dialogue between a client and counselor aimed at enabling the client to cope up with the stress and make a personal decision related to HIV and AIDS testing. So, as far as consent and counseling is concerned, pre-test counseling, then informed and voluntary consent for testing, and post-test counseling before handing over the test result. It includes an evaluation of a personal risk of HIV transmission and palliation of preventive behavior. One more case. It was case of post-transfusion hepatitis. And in this particular case, check label and certificate before transfusion, no other method to test before transfusion, and it is understood that bottle is as per specification mentioned on bottle. So, in this case also, decision was in favor of doctor. But question was asked, does consent require for blood transfusion? Let us see one case. Mrs. Prakash, second gravida, primi, previous LSCS, underwent cesarean section, excessive bleeding during surgery, 2 units of PCV were transfused. On just starting 3rd unit, she developed breathlessness, condition was worsened and shifted to ICU. Allegation on part of relative was, consent was not taken for blood transfusion. Defense on part of doctor was, when consent for surgery was taken, possibility of excessive bleeding and requirement of blood transfusion was mentioned. But inference held in the court was, the doctor is required to get 2 separate consent from the patient, one for surgery or procedure and another for blood transfusion if anticipated. Because inference held, surgery involves risk and blood transfusion involves additional risk. One more case. A rickshaw driver approaches to family physician clinic at 8 p.m. with a gasping patient. That family physician examined patient in the rickshaw only and sent him to nearby general hospital immediately for further treatment. But on the way patient expired, general hospital received him dead, postmortem was done, and ultimately notice was served against family physician for negligence. So here comes importance of golden hour treatment, and then only one should refer patient to a nearby center. And at the same time, you should have proper counseling, not to have any litigation due to misunderstanding on part of relative of patient. So here the question comes, can one select patient? Can one refuse to treat? On 12th of August 2014 in Parliament, then Union Health Minister put this bill in the Parliament, in which it was written that in case of emergency, a physician must treat the patient and no physician shall arbitrarily refuse treatment to a patient except where the patient is suffering from an ailment that is not within the range of experience of the treating physician. In the later cases, physician may refuse treatment and refer patient to another physician. But in addition, as per guidelines of reference for patient in emergency issued by Ministry of Health and Family Welfare on 31st of July 2014, every clinical establishment shall provide within the staff and facilities available such medical examination and treatment as may be required to provide first aid to any individual who comes or is brought to such clinic establishment. So it was expected in this particular bill that each and every physician is under obligation to treat patient irrespective of his or her specialty as far as emergency is concerned for primary treatment, and vitals should be taken care of, and then only patient should be referred to another hospital. One more case. Surgeon decided to operate on compounder's nephew for tonsillectomy totally free of charge. When he was to operate totally free of charge, he didn't prepare any case paper in good faith because it was for free of charge. But unlucky on part of patient and doctor, patient died on table due to complication of anesthesia, and notice was served to the surgeon, that is ENT surgeon, and anesthesiologist both. So here comes the importance of proper documentation. One more case. Medical officer issued certificate of rest in back date. But during that particular period, patient was in custody for some crime. So department filed complaint against medical officer for fabrication of evidence giving a false certificate. Defense on part of doctor was person whom he examined and issued the certificate was different person. So judgment was of course in favor of doctor. Doctor was lucky enough, but it is very dangerous to issue certificate in back date. So never issue certificate in back date, that is post dated. Take signature and thumb impression of person whom you are issuing a certificate. Put identification mark. As far as death certificate is concerned, if you are sure of cause of death, you can very well give death certificate. Otherwise, always advise for post-mortem examination. So never issue death certificate when you are not sure of cause of death. Advise post-mortem examination if required, because under IPC section 191 to 229, giving false evidence or fabricating evidence, it is punishable offense. One more case. It was case of high blood pressure, developed hemiplegia, facial part improved but with treatment, but hand didn't. Defense on part of doctor was it is known consequences and no contrary evidence. So case was dismissed in favor of doctor. So in all these type of cases, if at all something goes wrong, either one receives notice or face litigations, what happens? Exploitation starts. When we are happily enjoying this type of parachute sailing, but we never know this much crocodiles are ready to receive us at the bank. And Vastraharan starts. When something goes wrong, Vastraharan starts. By whom? By patient, by relative, by politicians, by police, by pleader, by press, by so-called social workers, by protection group, so-called consumer protection organization. And what could be the reaction on part of doctor? Litigation, oh my God. And one is confused. And naturally, when one is facing this type of signal at crossroad, one will be confused. One may try to hide the things. One may be panic. One may try to ignore the things. One may try to influence the situation through friends, through relatives, by money, through muscle power, or through politicians. And many a times, legal phobia starts. But is this the end of road, friends? No. Then what to do? Think positive, do positive, and be positive. Of course, it is very difficult, but stay calm and try to avoid surprise, anger, panic, and self-doubt. Do not ignore the situation. Be honest and do not try to hide any facts. Inform insurance company if you are covered with insurance. Have a talk to your senior colleague and have a advice from him, that is a medical opinion. You can have a phone call to your advocate and have a legal opinion. You can have a phone call to me, Dr. MC Patel, and have a medico-legal opinion and relax. Reply on letter pad when you are served with a notice. Explain about patient symptoms, signs, investigations, treatment given, and other doctor's note if you have availed services from your professional colleague. And keep a copy of all your correspondence. Do not get confused whether boy is hugging the girl or girl is hugging the boy. Never get confused, but manage the situation promptly, precisely, efficiently, effectively, and meticulously. But in all these situations, records are always at your rescue, because record is the who, what, where, and when of patient care in the hospital. In past year only, on 15 December 2014, one judgment came in which compensation of rupees 18 lakhs was awarded in favor of patient. Case was a case for knee joint replacement, and after operation there was loosening of prosthesis. But in documentation, doctor had not mentioned about the possibility of loosening of prosthesis. So panel of advocate took the inference. The panel, however, did not find any record showing what steps were taken by doctors to address loosening of the prosthesis components, and compensation of rupees 18 lakhs was awarded. So as far as records are concerned, keep them up to date. What was done? Nothing was neglected. Given treatment fully met with the standards demanded by law and ethics, and it should be easily acceptable whenever offered in the court, because a doctor is bound to produce record whenever asked by court, and if he doesn't, then adverse inference might be drawn. As far as documentation are concerned, purpose is to prove quality of care, coordination of care, patient's safety, and it provides legal protection. And it is also useful for research and continuing education program. And it is very natural. Good record is good defense, poor record is poor defense, and no record is no defense. And it has been my experience during my medico-legal practice, we doctors' friends are very poor as far as record keeping is concerned. So as far as record is concerned, outdoor and indoor register, prescriptions, case paper, that is outdoor and indoor, it should be fully written up with all the details. If you have record of X-ray and sonography, ECG, biopsy, certificates, if you have issued any kind of certificate, either to the patient or to the relative, you should have copy of that. Opinion from other doctors, make a habit to make them, to enter in the record, seen by Dr. So-and-so, their findings, their advice about investigation or treatment. And if at all they have advised any kind of treatment, and if you have executed that treatment, it should be shown in your nursing chart. Then it will be very much important. Record should not be tempered with later date. Any retrospective entry should be clearly marked Do not alter records because it leads to a loss of credibility in the court. Keep record up to date in chronological manner, not too perfect, because many a times when you keep too perfect record, smart advocate on other side may ask for the records for all the co-patient in that given period, and if you have prepared that case in very perfect manner, it may be against you in some cases. It should not be visibly manipulated. Omissions of obvious step you cannot afford. Contradictory notes you cannot afford. Say for example, some findings are in favor of myocardial infarction and some are in favor of acid peptic disease. Many a times court may get confused and it may be difficult for you to prove innocent. You should be ready with more than one set whenever asked by authority. You can have record on paper, on dictaphone, on computer or any other media. You should preserve record at least for 7 years. As far as CPA cases are concerned, for 3 years. For PCP-NDT cases, 2 years. For MTP cases, for 5 years. And as far as pediatric group of patient is concerned, 18 plus 3 years. And as far as income tax purpose is concerned, for 10 years. As such, there is no fixed guideline for this period, for how much we should preserve record. But this is designed through certain case laws. There are two types of law. One is statutory law, which is passed in Parliament, and one is case law. When in any case, court has some observation or court decides something, it becomes precedent for further cases in future, and it becomes a case law. So this is derived from this type of case law. Important bills. It is also very much important. You should have copy of important bills. Say for example, purchase of oxygen cylinder or refilling of oxygen cylinder, ventilator, defibrillator, emergency instrument, ambu bag or emergency drugs. Let us see very important case about this. It was case of Consumer Education and Research Society versus Dr. K.M. Shah, which was decided in National Commission, New Delhi. Case was like this. Patient was banker. He went to dentist for tooth extraction, and after a tooth extraction, he developed swelling in left side of the neck after 20 days. Surgeon's opinion was taken and case was diagnosed at a case of Ludwig's angina. Surgery was advised. He was properly investigated before surgery and he was taken for surgery. Anesthesia was given, but on the table, he developed sudden cardiac arrest. CPR revived successfully, but ultimately, patient was shifted to Bailal General Hospital, which is famous hospital in Vadodara in Gujarat, in unconscious state and with anesthesiologist in ambulance, and ultimately patient was shifted to Ahmedabad for further treatment. Ultimately, patient went into vegetative form and didn't improve, and patient was discharged without any improvement. So case was filed against anesthesiologist and compensation demanded was 99.5 lakhs. It was case in National Commission. So allegation was there was deficiency in services and negligence on part of anesthesia, and it was lack of oxygen cylinder in OT, no oxygen cylinder in OT when patient suffered heart attack. Defense on part of anesthesiologist was he was qualified anesthesiologist with experience of 15 years. He carries ventilator, cardiac monitor and pulse oximeter with him for all the calls, and it is his routine practice. He also provides literature. Ludwig's angina carries high mortality rate because it can lead airway blockage. He produced in the court OT register and O2 purchase and utilization register, and relevant literature was also produced. He also mentioned obesity, short neck, edema overflow of mouth are more prone to cardiac arrest. And inference held in court with all this argument, there was sufficient stock of oxygen cylinder in OT during surgery. He didn't suffer due to lack of oxygen, took proper care and treatment even after cardiac arrest. So case was dismissed in favor of doctor in this particular. But in this particular, doctor was saved only due to that bill of purchase of oxygen cylinder, which he saved this anesthesiologist in this particular case. So as far as record are concerned, proper record are to be submitted at proper place to proper person with proper acknowledgement. So looks like avoiding medico-legal problems in our practice is a difficult balancing art. Not at all. Practice good communication and documentation and you will simply sail through. Keep originals with you while doing all the correspondence. Telephonic instruction always to be avoided. Making statements that might be construed as an admission of fault on your part should always be avoided. Try to avoid self-doubt with patient or her relatives on consenting the incidents. Casual discussion of treatment given with anyone should always be avoided. Review textbook and medical literatures relating to your case both in favor and against. This is very much important. Give follow-up treatment to the patient who has given you a notice if required, because you cannot abandon patient in between, and if as usual this is not acceded to, then a case may be filed, but on the other hand, if answered properly, may prevent further litigations. So how to prevent all this situation? There are certain alarming situations, and you should be alert and vigilant in this type of situations. Patients or relatives' dissatisfaction, asking to take second opinion, and if you have refused, asking to shift patient to another center, and if you have refused, complication or unexpected result, failure of procedure or operation, trauma, injury, hemorrhage, infection, complication of anesthesia, death of a young patient, request for medical records, and if you have refused, failure of patient to keep schedule follow-up. But all in this situation, court or law expect from you foreseeability or anticipation. Anticipation about complication, about procedure required, or intensive care. Say for example, if you are a gynecologist and dealing with a history of previous 2 LSCS and you are proceeding with a case of central placenta previa, naturally you should anticipate complication like postpartum hemorrhage, and you should be readily available with blood. So in court of law, anticipation or foreseeability is expected from you. And another good part is counseling, but not mere counseling, proper counseling. See one case recently decided in state of Tamil Nadu, and compensation of worth rupees 1.8 crore was awarded in favor of patient and relative. Case was like this: before 18 years, patient was delivered prematurely. Premature baby was handed over to neonatologist for further care. Baby was put in incubator. After due care, caution, and some period, patient was discharged. But at the time of discharge, neonatologist didn't advise proper instruction to follow up for certain investigation and counseling with certain doctors, including ophthalmologist, because in prematurity, premature retinopathy may be one of the complications, and in this particular case, it happened, and that baby ultimately went blind. So case was filed against neonatologist and that government hospital in Tamil Nadu. Compensation of rupees 5 lakhs was awarded in favor of patient and her relative, but they preferred appeal in Supreme Court, this National Commission, and ultimately in Supreme Court. And in Supreme Court, this decision came just before 15 days or so. Compensation of rupees 1 crore and 73 lakhs was to be paid by government of Tamil Nadu, and a rest of 8 lakhs was to be paid by that neonatologist to that patient and relative of patient. So, communication is the key to avoid all this litigation, because we might have the best medicine in the world, but it won't be successful if the patient doesn't understand it. And at the time of counseling, usually we start with, what is your complaint? And patient will answer. But there are many a times there are so many questions in the mind of patient or relative. Why did it happen? How it can be avoided? Will it happen again? Could it have been avoided? So there are so many questions on part of patient or relative. So encourage them always to ask patient. And it should be in a common vernacular language. Avoid medical jargons, because if you have explained everything in a simple language, it will be useful for patient as well as for you also. One more thing, no rosy picture about the result or no tall claim about the result. Because in eye of law, when you claim to be master, then you are supposed to be master. And in our practice, many a time we consider result of our treatment or surgery or procedure like Aishwarya Rai, but it may turn like this at any time in clinical practice. So no tall claim, no rosy picture about result. Take tender care of your patient and be ready to helpful to your professional colleague in every given situation. And at the same time, do not hesitate to take help from your professional colleague, because balanced teamwork is always beneficial for the patient and for you also. Select proper staff and supervise and lead them properly. कठोर परिश्रम का कोई विकल्प नहीं. Never ever keep up trying and ultimately you may be succeeded. Use your optimum skill. Always examine a female patient in presence of a female nurse or relative. This is for male doctor. Always obtain informed consent before doing any procedure or surgery. Visit your indoor patients regularly and make a habit to enter it into your indoor record. Check your equipments, instrument, medicine at regular intervals and keep up to date on safety regulations and emergency kits. Do not ignore any complication due to size, because even a smaller complication may be troublesome in future in any given case. Do not get hit wicked. Know your limitations. Do not take risk. Remain alert every time. Otherwise, be ready to face this type of situation. Observe confidentiality. Patient must not be abandoned. Give proper instruction to the patient. This is very much important. At the time of discharge, say for example in indoor case, give proper instruction about medicine to be taken, about diet, about exercise, about follow-up. If at all patient doesn't follow your instruction, then it becomes contributory negligence on part of patient and it becomes a very good defense in your favor. You will be observing many a times patient usually accompanied by some of the relative and relative complaints on part of patient. Doctor, she is not taking medicine properly. She is not taking milk properly. She is not taking proper diet. Make a habit to enter in the record. Patient is not taking medicine properly, history given by mother-in-law. This simple sentence becomes a good defense in your favor, because it becomes a contributory negligence on part of patient. This is statistical data of professional protection scum, which I mentioned earlier, run by IMA, Gujarat State. In 40% litigation, doctor is behind doctor, because in our fraternity, scenario is like this. Like this. So it's not working. Like this. So do not criticize other doctors or paramedical persons, because many a times you consider yourself to be smart, but your colleague could be much smarter than you. Let us see a small clipping. So don't try to be smarter with your professional colleague. If this is possible, and if cat and dog can share milk from the same dish, then why can't we? So of course fight with each other, but be ready to fight for each other. And be ready to helpful to be your professional colleague like this. One more small clipping. In 40% litigations, rough behavior on part of doctor and hospital staff is responsible. So 40 plus 40, almost 80% litigations are preventable. Courtesy, consideration, communication is always beneficial. Your approach should be to the patient should be like this, but not like this. So remember, your existence depends upon the patient. Proper attention to the patient is, and as well as to the relative, in all respect, is always beneficial to you. Do not spoil your general impression because your deed is always watched by somebody. Never say I am insured. If at all you are insured with some insurance company, many times some of our colleagues has habit, do whatever you like, I am insured with insurance company. Never say like this. Because as soon as you say like this, you lose sympathy on part of patient or relative, and you may be put into trouble as far as litigations are concerned. Those who are open, pleasant and communicative are much less to be sued, as patients are extremely forgiving of errors made by a friendly and concerned medical attendants. No cross-pathy practice, no cross-speciality practice, because it is clear-cut verdict from Supreme Court. One should practice in pathy in which he or she has been taught. Never detain patient for recovering the fees, because you may invite wrongful confinement under section 340 of IPC. Patient cannot be detained for non-payment of fees. There is provision of imprisonment of 1 year and or fine of ₹1,000 or both. Have some basic legal knowledge. Always obtain medico-legal advice whenever you are in doubt, and be vigilant in your practice with this carry-on messages. Take valid consent, proper pre-operative investigations, due care during treatment and surgery, meticulous record and proper documentation, expert opinion whenever you are in need, formation of local level medico-legal cells, because in given situation you can avail services or help from member of that medico-legal cell. Identify yourself well in the court, otherwise be ready to face this type of situation in court. Naturally we cross zebra crossing, but day may come that zebra may cross human crossing. So if you want to sleep like this, take tender care of your patient, pray your Almighty God before going to sleep, and keep my visiting card below your pillow. If ever you need me, I will be just round the corner. And what we do when there is a fire? Naturally, we call firefighters, so nothing to worry. Manage the situation accordingly. One fine morning, gentleman was reading newspaper and devil appeared. And devil said, I am devil. Gentleman said, yes, good for you. Are you not afraid of me? No, not the least. Did you know that I could cause you profile physical and mental agony? Then also you are not afraid of me? No, not the least. I am not afraid of me. And that they will ask, why? Then that gentleman said, I have been married to your sister since last 37 years. And that is clinical practice. So in spite of all this occupational and professional hazard, our service to serve human and mankind is always on and on. Medicine is not exact science. I shall use my experience, knowledge and judgments to its best. I may go wrong, or anything with patient may go wrong anytime. I guarantee nothing but my honest effort and care for you. I am not God, but well-trained professional wanting to take care of patient. And it is very obvious. A good doctor treats the disease, but a great doctor treats the patient. And very nicely said by Swami Vivekananda ji, Real genius is one who can hold two opposing ideas in mind at the same time and still maintain the ability to work in a smooth, efficient, and fast manner. And I think Swami Vivekananda has written this sentence for doctors only. Because see, real genius is one who can hold two opposing ideas in the mind at the same time and still maintain the ability to work in a smooth, efficient, and fast manner. Only doctor can. So do not tell God that you have problem. Turn to the problem and say that you have God. Again, Swami Vivekananda has rightly said, difficulties come because there are possibilities in you and go hand in hand as far as medical practice is concerned. And if at all required, I would be always at your assistance. Rightly said by Albert Einstein, only two things are infinite, the universe and human stupidity, and I am not sure of the former, so wish you and me too all the best. God bless you and have a litigation-free medical practice. And see, last clipping, this is a law of leopard behind innocent doctor. And this is role of medico-legal counselor. With regards and salute to organizers, thank you very much for patience hearing.